of our presentation. Our presentation today is about the ankle. Okay, about the ankle joint. Now we start in the bones of the foot. The foot have 7 tarsal bones: the talus, calcaneus, navicular, cuboid, and 3 cuneiforms, and 5 metatarsals, and 14 phalanges. The 2 most important bones in the foot are the talus and the calcaneus. The talus, the long axis of the talus point forward and medially, and it has a body, neck, and head and posterior process. The inferior surface has a large facet posteriorly that articulate with the calcaneus, and anterior facet and medial facet for sustanculum tali of the calcaneus. Here the inferior surface of the talus. Here's the head and the articular surface for navicular bone, and the large posterior facet for articulation of the calcaneus, and the medial facet for sustanculum tali, and the anterior facet. The calcaneus is the largest bone in the foot. It has a long axis, points forward and laterally. It has a shelf-like process, the sustanculum tali. The plantar surface has large calcaneal tuberosity posteriorly, medial, that consists of medial and lateral tubercle with a small peroneal tubercle on the lateral surface. The upper surface has 3 facets that articulate with the corresponding facets of the talus. Here of the talus. This is the sustanculum tali with the middle facet that articulate with the corresponding facet and the anterior facet. Here a lateral X-ray of the ankle joint showing the calcaneus and the talus. It has head, neck, and body. This area is called the sinus tarsi. The ankle joint is the synovial hinge joint. It has the articular surfaces of the ankle joint, the lower tibia, and the inner surface of the medial malleolus, the medial surface of the lateral malleolus of the fibula, and the trochlear surface of the head of the talus. The articular surface of the talus is broader anteriorly than posteriorly, and this makes the ankle more stable in dorsiflexion or standing, and more mobile in plantar flexion. The capsule is attached to the margins of the articular surfaces, except where it extends distally to the neck of the talus. The synovium, it lines the capsule and frequently passes up between the lower ends of the tibia and fibula. The ligaments, there are 4 major ligamental stabilizers of the foot and the ankle. The medial collateral ligament, or it's called the deltoid ligament, the lateral collateral ligaments, the syndesmotic complex, which is the distal tibio-fibular joint of between the tibia and fibula, and the interosseous talocalcaneal ligament. This picture showing us the deltoid ligament on the medial aspect of the ankle joint. It has 5 components: the tibio-navicular, the tibio-spring, the tibio-calcaneal, and the superficial posterior tibio-talar ligament, and the deep posterior tibio-talar ligament. And here's the lateral view of the ankle joint, showing us the anterior tibio-fibular ligament and the posterior tibio-fibular ligament, and those is called the syndesmotic complex, those ligaments. And this is the anterior talofibular ligament and the posterior talofibular ligament, and this is the calcaneofibular ligament. The subtalar joint is a synovial joint responsible for inversion and eversion of the foot. It has 2 parts: the talocalcaneal joint between the posterior facet and on the inferior surface of the talus, and the corresponding facet of the calcaneus. The second part of subtalar joint is the talocalcaneonavicular joint, which has four contiguous parts between the inferior surface of the talus and the sustanculum tali here, and the sustanculum tali of the calcaneus, the plantar calcaneonavicular or spring ligament, and the anterior talocalcaneal facet here, and between the head of the talus and the navicular bone, head of the talus, navicular bone. A plain film of the ankle joint. On AP radiographs of the ankle joint, the tibiotalar surface are seen parallel to each other and perpendicular to the shaft of the tibia. The articular surfaces of the malleoli on each side are symmetrical about a line through the shaft of the tibia, each making an equal angle with the inferior surface of the tibia. The medial and lateral ligaments of the ankle joint are not visible on a plain radiograph, but their integrity can be demonstrated from normal joint alignment in standard views and stress views. The distance between the medial malleolus and the talus is increased. Then, if this distance is increased, then a disruption of the deltoid ligament can be diagnosed. If the distance between the lateral malleolus and the talus increased without bony injury, this is due to disruption of the lateral ligament. In general, loss of parallelism of the articular surfaces is considered significant. This is a plain film stress view showing widening of the space between the medial malleolus and the talus, and it indicates a deltoid ligament injury. Arthrography. The synovial cavity is outlined by injection of contrast, and the integrity of the medial and lateral ligaments can be assessed. This is the normal ankle arthrogram. This is the AP view. And we note there is a medial and lateral pods. And this is oblique view. And it's showing filling of the distal tibiofibular joint. And this is a lateral view, and it has an anterior and posterior pods. MRI anatomy. The Achilles tendon can be seen inserting into the posterior aspect of the calcaneus and separated from the posterior surface of the tibia by a fat pad. The cartilaginous surface of the articulating bones can be visualized directly, as can the deltoid and talofibular ligaments. The tendons of the tibialis anterior and extensor hallucis longus, extensor digitorum longus, pass deep to the extensor retinaculum of the anterior aspect of the joint, and the tendons of the peroneus longus and brevis pass beneath the peroneal retinaculum on the lateral aspect of the ankle. The tendons of flexor digitorum longus and flexor hallucis longus and tibialis posterior passes deep to the flexor retinaculum and separate fibro-osseous tunnel. Here, a picture showing us the extensor retinaculum. This is the extensor retinaculum, and these are the extensor digitorum longus and the extensor hallucis longus. And here is the peroneal retinaculum, superior and inferior peroneal retinaculi. And this is tibialis brevis muscle. The syndesmosis. The syndesmosis is a term used to describe three stabilizing components of the inferior tibiofibular articulation: the anterior tibiofibular ligament, and the posterior tibiofibular ligament, and the interosseous membrane. The lateral collateral ligament. It provides lateral stability and has 5 components: the anterior talofibular ligament, which is commonly injured, and the posterior talofibular ligament, which is extremely rarely injured, the calcaneofibular ligament, and the syndesmotic complex, which includes the anterior and posterior tibiofibular ligament. The anterior talofibular ligament, it's visualized by direct axial plane and running anterior-medially from the tip of the lateral malleolus to the anterior lateral aspect of the talus. And it is homogeneously hypointense in all sequences. Here's the anterior talofibular ligament, and it is hypointense. Okay. This is coronal MRI showing us the anterior syndesmosis, and this is the anterior talofibular ligament. The posterior talofibular ligament, it is a fan-shaped iso-intense structure that's usually identified on the same image as the anterior talofibular ligament in the direct axial plane, and it runs from the malleolar fossa on the inner aspect of the lateral malleolus to the posterior tubercle of the talus, and extremely strong and rarely injured. This is the posterior talofibular ligament, and it appears as iso-intense structure. And here's the anterior talofibular ligament, as we mentioned. The calcaneofibular ligament. This ligament is identified as fine linear structure deep to the peroneal tendons, and it is hypointense in all sequences. This is calcaneofibular ligament, the hypointense, this hypointense line. This is the posterior talofibular ligament in another picture, and posterior syndesmosis. Now we go for medial collateral ligament, or what's called the deltoid ligament. The medial collateral ligament is triangular fan-shaped, and it has 5 components that can be divided into superficial and deep layers. The anterior tibiotalar joint. This is the anterior tibiotalar joint. And the posterior tibiotalar joint. This is the posterior tibiotalar joint. The tibiocalcaneal joint, and the tibionavicular joint, and the tibiospring. On MRI, the superficial components of the deltoid ligament, the superficial component of the medial collateral ligament is fan-shaped and only visualized on multiple oblique planes. The deep component is routinely identified on a direct coronal image as short striated structure. This is a coronal MRI oblique view showing us the deep component of the deltoid ligament and superficial component of the deltoid ligament. This is an axial MRI showing us the anterior talofibular ligament, the posterior talofibular ligament, and this is the deep deltoid ligament and superficial deltoid ligament. Injury to the medial collateral ligament accompanied by complex angle trauma and invariably associated with disruption of the lateral collateral ligament or the syndesmosis. Here's a coronal MRI showing us the deltoid ligament. This is the deltoid ligament showing us injury and increased signal intensity. Ligaments of sinus tarsi. This is the sinus tarsi is the cone-shaped space between the inferolateral border of the talus and the superolateral surface of the calcaneus. In health, the sinus is predominantly filled with fat. Its stability is maintained by 2 ligaments. The cervical ligament, and the most important one, is the interosseous talocalcaneal ligament. This picture showing us sinus tarsi between the talus and the calcaneus, and this is the interosseous talocalcaneal ligament. Sinus tarsi syndrome is pain or injury to the area of sinus tarsi, a traumatic injury or overuse due to repetitive standing or walking are the main causes. Its primary instability of the subtalar joint due to ligamentous injury that result in synovitis and infiltration of the fibrotic tissues into the sinus tarsi space. Because the sinus tarsi is richly vascularized, the rupture of ligaments readily heal without surgical intervention, although scarring and persistent laxity may result in long-term instability. Now, this is a sagittal MRI showing us, number one, the Achilles tendon, and this is the flexor hallucis longus muscle belly, and this is the tibia, the talus, and this is the tibiotalar articulation, and this is the posterior subtalar joint, and the sinus. This is the sinus tarsi and interosseous ligaments. This is the calcaneus, and this is the calcaneonavicular joint, and this is the plantar aponeurosis. This is the coronal MRI showing us the medial malleolus, number one, and the lateral malleolus. And this is the inferior tibiofibular articulation, or it's called the syndesmosis. This is the talus, body of talus. And this is the tibio-calcaneal ligament, and the tibialis posterior tendon. And here is the fibulocalcaneal ligament on the medial aspect. And this is number 13, the calcaneus, the sestanculum tali, and number 15, peroneus brevis, and 14 is the peroneus longus muscle. Now we go for muscles of the lower limb. A knowledge of the origin and course and exertion of the muscles is less important in radiology than understanding of relative position of the muscle groups, as seen in cross-sectional imaging modalities such as CT and MRI. Now we will discuss cross-sections of the upper thigh, middle thigh, and lower leg. Muscles of the thigh. In upper thigh, muscles that flex the hip and extend the knee are found anteriorly in the anterior compartment. And these are the quadriceps femoris muscle, which is made up of rectus femoris and the vastus lateralis and vastus medialis and vastus intermedius muscle. The sartorius is a thin, flat strap muscle with a similar action and is also found superficially in the anterior compartment. Now we go for the medial compartment, or it's called the adductor compartment. The adductor muscles are found medially, and these are forms anterior to posterior, the adductor longus, the adductor brevis, the adductor magnus, with the adductor gracilis lying superficially. Posteriorly lie the extensor groups of the hip and the glutei, and the flexors of the knee, the hamstring, which includes the biceps femoris and semimembranosus and semitendinosus muscle. The femoral artery and vein and nerve lie superficially between the anterior and adductor compartments, with the profunda femoris vessels lying deeply close to the femur in the same plane. This picture showing us the anterior compartment group. This is the quadriceps femoris, and this is the sartorius, this vastus medialis, vastus lateralis, and the rectus femoris. And this cross-section showing us the anterior muscle group, rectus femoris, and the vastus medialis, vastus lateralis, vastus intermedius, and this is the posterior compartment, and this is the adductor or medial compartment. This is a medial compartment muscle group, which include the adductor brevis, is the smallest one, and the adductor longus, and this is the adductor magnus. This is the posterior compartment muscle group, which includes the biceps femoris and the semitendinosus and the semimembranosus. This is a cross-section MRI showing us the compartments of the thigh, of the upper thigh, which includes the sartorius muscle, which is the most superficial one. The rectus femoris is most anterior one. The vastus lateralis, and this is vastus medialis, and this is vastus intermedius around the femur. This is the femur, and this is the adductor muscle group, adductor longus, adductor gracilis, which is the most superficial one, and the adductor brevis, and the adductor magnus, which is the most posterior one. And this is the posterior muscle group, part of the posterior muscle group, which is the semitendinosus muscle. And this is the gluteus maximus muscle. And here is the area where the sciatic nerve it passes in the posterior compartment. At the mid-thigh level, the shaft of the femur is surrounded by the rectus femoris and the vastus muscles medially, anteriorly, and laterally. The shaft of the femur is surrounded posterior-medially by the adductors and the posterior-laterally by the biceps and semitendinosus and semimembranosus. This is a cross-section across the mid-thigh showing us the femur, the medullary cavity of the femur, the cortex of the femur. This is the rectus femoris, most anterior one, and the vastus lateralis laterally, the vastus medialis medially, and the vastus intermedius around the femur, and the medial muscle group, which includes this one is the sartorius, because it passes obliquely from the anterior superior iliac spine. Number 9, the adductor magnus, and the adductor gracilis, and 15 is the deep femoral vessels, and this is the posterior muscle group, which includes the biceps femoris, and the semitendinosus, and the semimembranosus, which surrounds the semitendinosus. And this is the area for sciatic nerve where it passes in the posterior compartment. Muscles of the leg. In the lower leg, the tibia lies anterior-medially, subcutaneously, and the fibula lies laterally and is more centrally placed. The interosseous membrane passes between the tibia and fibula and separates the leg into anterior and posterior compartments. This cross-section of the leg showing us the tibia, fibula, the interosseous membrane, and this is the anterior compartment. This is the lateral or peroneal compartment. This is the deep compartment, the posterior compartment, which divided into deep and superficial ones. Anterior to the osseous membrane lies the extensors or dorsiflexors of the ankle and the toe, the tibialis anterior, and the extensor digitorum longus. The peroneum tertius is also part of this group. It extends the ankle in addition to everting the ankle, and is found below and the lower third of the fibula. This picture showing us the anterior compartment muscle group, which includes the tibialis anterior, extensor hallucis longus, extensor digitorum longus, and the fibularis tertius, or it's called the peroneus tertius. This is fibularis longus, and this is the tibia, the tibialis anterior, and the extensor digitorum, and the extensor hallucis longus, and the peroneus tertius. Posterior to the interosseous membrane lies the flexor the flexors of the ankle and the toes. The posterior compartment is divided into deep group, which includes the tibialis posterior, and in the lower third, the flexor digitorum longus and the flexor hallucis longus. More superficially lying the soleus and the gastrocnemius muscle with its medial and lateral heads. The later two muscles unite inferiorly to form the calcaneus or Achilles tendon. Here's the posterior compartment muscle group. This is tibialis posterior, the flexor hallucis longus, and the flexor digitorum longus. The lateral compartment contains two peroneal muscles, the peroneus longus and the peroneus brevis in the distal 2/3. These are everters of the ankle. This picture showing us the peroneus longus, and this is the peroneus brevis. Another cross section showing us the anterior compartment muscle group, lateral compartment, and posterior compartment with the deep part and superficial part. This is an axial MRI proton density showing us the medulla of the tibia, this one, the cortex of the tibia, and this is the fibula, and this one is the muscles of the anterior tibial compartment, and this is number 13 is the peroneus longus. Number 10 is the soleus, the lateral head of the gastrocnemius. Number 11 is the soleus muscle, and this is a deep compartment muscle group, which includes the tibialis posterior and the anterior, and this is the interosseous membrane in between the tibia and fibula, and interosseous membrane here anteriorly. Thank you.
عاشت ايدك دكتور علي. Nice presentation. غطيت الانكل والمسلز of the lower limb. صفحة الشامل.
نعم أستاذ.
Number 1.
Number 1 medulla of the femur. Axial MRI.
Axial MRI.
medulla of the femur. Number 1. شنو أستاذ؟
يا sequence.
sequence زي T2.
T2. Okay. T1 ولا T2؟
T2. T.
Proton density.
Proton density. Proton density.
بروتون. عادة بلا مسكي وبروتون دنسي. كلمة على مكي. Number 2.
Cortex of femur.
سما إبراهيم. سالي عبد الرضا.
نعم أستاذ. الثالثة rectus femoris.
rectus femoris. anterior compartment. زيد يوسف.
نعم أستاذ. Number 4 vastus lateralis.
vastus lateralis. زين. زهراء علي رشيد. رنين رفعت.
نعم. Number 5 vastus intermedius.
بلى. و6 عقيل.
نعم أستاذ. 6 vastus medial muscle.
اوكي. هي هذه كلها الجروب. هسه الواحد يقدر يقول posterior compartment muscle احسن مما تنفصلين واحده واحده. اعتقد ماكو داعي كلن يحفظن واحده واحده.
anterior compartment طبعا.
anterior compartment.
نعم أستاذ.
زين. نروح على صريح. نور علي نمبر 7.
نعم أستاذ. سارتوريوس مصر.
سارتوريوس مصر.
عفوا أستاذ، أنا بس هذا كويز يعني ب 13 نقطة.
أوكي أستاذ محمد كمل، وصلنا رقم 8.
نعم أستاذ. محمد فرحان نمبر 8.
نعم أستاذ. السوبرفيشال فيمورال فيزلز.
عمر فهمي نمبر 9.
نعم أستاذ. الدكتور ماغنس.
دار نصير نمبر 10.
نعم أستاذ. بايسكس فيمورس.
أحمد خليل 11.
نعم أستاذ. سيمي تندينوس.
زهراء صباح 12.
نعم أستاذ. سيمي ممبرينوسس.
نور قاطع نمبر 13.
نعم دكتور. جراسلس مصر.
رشا داخل.
هاي
خلص.
أستاذ.
خلصت.